Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hi, my name is Jerry Hickey. I just finished recording an episode on a nutrient called quercetin that's found in really good foods that's also available as a supplement. And it's great influence on many things in the human body. For instance, it's helpful with generalized systemic low-grade chronic inflammation, long-term inflammation. Long-term low-grade inflammation, you don't feel it, but it's there, and it's not good for your brain or your eyes or your heart or many other parts of the body, and it's not good for longevity. It's not good for health. It's not good for longevity. So quercetin helps ameliorate chronic low-grade inflammation. It's also good for lung health. I discussed this in the first episode. And the title of that episode, and this is really part two of that episode, is quercetin and its influence on inflammation, lung health, and blood pressure. So when you eat good foods, the foods with quercetin, the other ingredients in it amplify the benefits of the quercetin, and all these things work like in a synergistic fashion, and they're really good for you. So when you eat like a Mediterranean type diet with lots of seeds and nuts and olives and high quality olive oil and some fish, and you're eating some fresh fruits and really high quality green leafy vegetables, you're getting some quercetin and you're getting other related flavonoids. But let's discuss a new report that came out on high blood pressure. High blood pressure technically is called hypertension. You're probably aware of that. So in this report came out actually in the fall. Blood pressure medication can prevent heart attacks and strokes. But we didn't realize how beneficial lowering blood pressure was, because this is even in people who've never had heart disease, who never had a heart attack or stroke, and even with kind of quasi-normal blood pressure. Lowering blood pressure a couple of points in the general population lowers their risk of developing heart disease later on, and heart disease, of course, leads to dementia, kidney problems, problems with your vision, all kinds of problems, but an increased risk of stroke and heart attack. So this is a Professor Rahimi, I hope I'm not slaughtering his name. He's at the University of Oxford. Now, Oxford and Cambridge are two of the best academic research institutions on planet Earth. They're up there with Harvard and Princeton and Stanford and MIT. I mean, they're just really high quality. So here's what Dr. Rahimi says. Greater drops in blood pressure with medication lead to greater reductions in the risk of heart attacks and strokes. He goes on to say, this holds true regardless of the starting blood pressure level. This is in people who previously had a heart attack or stroke, but also in people who never had heart disease. They might have almost normal blood pressure. So they divided people into different groups. Those who already had a diagnosis of cardiovascular disease and those who do not. And then they based their findings, they split these people up into different levels of blood pressure. So people with normal blood pressure were included in the study, and people with really high blood pressure, like 170. The top figure was 170. That's the systolic blood pressure. Over an average of 4 years of follow-up, they followed all these people for 4 years. Each 5 millimeter reduction in systolic blood pressure, the top figure in your blood pressure, reduced the relative risk of a major cardiovascular event by about 10%. A major cardiovascular event is a heart attack or a stroke. So the risk for a heart attack, lowering your blood pressure by 5 points, lowered your risk of a heart attack by 13%. Your risk of ischemic heart disease by 7%. That's a very dangerous situation where the heart's not getting enough blood. You see in those movies where somebody gets a fright and they get sudden chest pain. That's ischemic heart disease. and lowers the risk of heart failure by 14%. I just did a podcast episode on heart failure. In fact, 2 episodes, because there's a lot to say. And lowers your risk of dying from heart disease by 5%. So even in otherwise healthy people, they're showing that lowering blood pressure has an impact on health, longevity, and survival. So here's a study looking at quercetin. And you're not going to get this amount of quercetin in your food. You'd have to take it as a supplement. For instance, we have a 500 milligram quercetin, which is pretty much a standard dosage. And this might be the first one to report on quercetin. I just cherry-picked several studies. I didn't pick like 10 studies. So this will be a relatively short episode because it's really part 2 of our initial episode. So this is the first one I saw of quercetin lowering blood pressure. It's from July 2008. And they gave these people 730 milligrams of quercetin every day. I don't know how they came to that conclusion. Normally I recommend like 500 milligrams twice a day with meals. These are people with high blood pressure. Their blood pressure was typically 150 over like 95. So that's enough to really trigger a stroke or a heart attack or to damage your brain or your kidneys. So it's a randomized, double-blind, placebo-controlled crossover study. So everybody in the study either got quercetin or placebo for a certain amount of time. Then there was a washout period where people got neither to get rid of the effects of the quercetin, and then they were switched over. So people previously on placebo are now on the quercetin. And I found there's no 2 ways about it. Over a 28-day period, quercetin absolutely lowered blood pressure, and it was a pretty good effect. So that was in the journal of Nutrition, actually. Now, there was a different study from the University of Utah where they found a similar result, that people taking a good dosage of quercetin, you really need about 1,000 milligrams of quercetin a day to lower your blood pressure. That giving people quercetin, people with high blood pressure, really did have an impact on their blood pressure. It's not as strong as a high blood pressure medication like a beta blocker or an ARB or an ACE inhibitor or a calcium channel blocker or a diuretic, but it's getting there. And it's safe to add to your high blood pressure medications. Frequently, people take high blood pressure medications and they still don't reach a sweet spot where their blood pressure is like really within like a normal level of like, 120 over 80 or 110 over 70, which is even better. Adding some quercetin can help further lower your blood pressure because it works differently. It works like an antioxidant, anti-inflammatory, restoring elasticity and resilience and the function of blood vessel walls. It improves the integrity of blood vessel walls, and they're working better. They're reacting to signals from the heart better. So you might get a further 5-point drop in your blood pressure, or even greater. The beauty of the quercetin, it's not going to lead to low blood pressure. It's not pushing your blood pressure down. It's allowing the blood vessels to work more efficiently and effectively, so it can help adjust your blood pressure somewhat. So here's the journal Nutrition Reviews. And I love nutrition reviews because they don't look at one study. They look at a cross-section of studies. That's called a meta-analysis. And when you do a meta-analysis, you're taking a whole bunch of studies looking at the same thing. In this case, they're looking at quercetin and people with high blood pressure. Does it help lower their blood pressure? And you get all these studies from these different websites like Ovid and Embase and Cochrane Library of Systematic Reviews and PubMed. And you put them all together, and then you go through them, and you save the ones that are really super high quality. And all of a sudden, instead of one study, which is just an indicator, all of a sudden you're looking at 7 or 10 or 20 studies. Now you've got real evidence. Because if you perform a meta-analysis, a high-quality meta-analysis based on high-quality data, you're proving that something either works or it doesn't work. So this is the journal Nutrition Reviews, and they showed that, absolutely, quercetin can reduce high blood pressure in people suffering with cardiovascular disease. So they already have blockages and thickened blood vessel walls and cholesterol plaques in their blood vessels. So this is a pooled analysis from 13 human clinical trials. Quercetin had a marked effect on systolic blood pressure. using quercetin for 8 weeks or more also lowered your LDL cholesterol, by the way. That's nice. But it lowered the top figure in your blood pressure by 10 millimeters of mercury. Now, remember, the first study, the pooled analysis of studies, showed that drugs that lower your blood pressure, if they lower your blood pressure even 5 points, cuts your risk of a stroke and a heart attack and developing heart failure and surviving. This is lowering the top figure by 10%, because it's not just drugs that lower your blood pressure. There are things in your food that also lower your blood pressure, like grapeseed extract, the mineral magnesium, sometimes adding more potassium to the diet. So there are things that help lower your blood pressure other than drugs. I'm not saying not to use drugs. And let me just say something here. I've had a number of people tell me, I'm using high blood pressure drugs, and that's really scaring me. And I say to them, having high blood pressure is a lot scarier than taking the drugs to lower your blood pressure. So in this study, it lowered the top figure in your blood pressure, the systolic, that's when the heart's actually pumping blood, by 10%, lowering the risk of heart failure by 50%, and lowering the risk of developing a stroke by 35 to 40%, and lowering the risk of having a heart attack by 20 to 25%. So quercetin is a good supplement to take. It does other wonderful things. It's good for the lungs. It's good for the immune system. It's good for a workout. It improves circulation to your muscles so you get a better workout. And it's safe to take, and I have no problem with taking 500 milligrams a day. In fact, I plan on adding it to my protocol of nutrients because it also has an effect of slowing the aging process. So I will start, even though I eat quercetin-rich foods, you're not getting enough to have these effects. The effect on longevity is called a senolytic effect. I'll have to do an episode on that. So thank you for tuning into the InVet Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invethealth.com/podcast. Please review us. Please subscribe. You can also follow us on Facebook, Twitter, and Instagram at InVet Health. I hope to see you next time on another episode of the InVet Health Podcast. If you have high blood pressure and you want to add to quercetin, take 500 milligrams twice a day with breakfast and dinner. If you just want it for longevity, 500 milligrams a day is enough. Thanks so much for listening.